Hello everyone, and welcome back to VitalHer. I'm so happy you're here with me today. I'm Dr. Mary Williams, a board-certified gynecologist with over 15 years of experience helping women navigate their health journeys. And today we're going to discuss something that I'm absolutely passionate about, the menopause symptoms that almost nobody talks about, but that affect millions of American women every single day. You know, when most people think of menopause, they immediately think of hot flashes and irregular periods. But here's what I've learned after treating thousands of women going through this transition. There are at least 10 other symptoms that are incredibly common, yet so many women, and unfortunately even some healthcare providers, don't recognize them as being connected to menopause. Just last week, I had a patient come into my office convinced she was developing early dementia because she couldn't remember simple things. Another woman was certain she had a serious heart condition because of palpitations. Both were experiencing completely normal but lesser-known menopause symptoms. I decided to create this video because I believe every woman deserves to understand what's happening in her body during this natural transition. Knowledge is power, and when you understand these symptoms, you can address them appropriately instead of suffering in silence or worrying unnecessarily. Before we dive in, I want to ask for your support. If you find this information helpful, please hit that subscribe button, leave me a comment sharing your thoughts, and don't forget to share this video with other women in your life. Your engagement truly helps me continue creating this essential content about women's health that we all need but rarely hear about. Today, I'm going to break this down into 2 comprehensive chapters. First, we'll explore the first 5 uncommon symptoms and understand why they happen, and then we'll discuss the remaining 5 symptoms plus what you can actually do about all of them. Let's dive right into these lesser-known symptoms that are affecting so many women, starting with what I consider the most misunderstood one. Symptom number 1, brain fog and memory issues. This is probably the symptom that causes the most anxiety among my patients. I can't tell you how many women have come to me terrified they're developing Alzheimer's disease because they're forgetting names, losing their keys, or struggling to find the right words in conversations. Let me tell you about Rebecca, a 48-year-old executive who came to see me last month. She said, "Dr. Williams, I've always been sharp as a tack, but lately I walk into rooms and forget why I'm there. I missed an important client meeting because I completely forgot about it. I'm scared something serious is wrong with my brain." The truth is, up to 60% of women experience cognitive changes during menopause. This happens because estrogen plays a crucial role in brain function, particularly in areas responsible for memory and executive function. As estrogen levels fluctuate and decline, these cognitive processes can be temporarily affected. Symptom number 2, joint aches and stiffness. Here's one that surprises almost everyone: joint pain during menopause. I regularly see women in their late 40s and early 50s who suddenly develop aching knees, stiff fingers, or shoulder pain, and they assume it's just aging or arthritis. Sarah, a yoga instructor, came to me frustrated because her hands were so stiff in the mornings that she could barely open water bottles. She was convinced she had rheumatoid arthritis, but her blood tests were completely normal. What she was experiencing was estrogen-related joint inflammation. Estrogen has anti-inflammatory properties and helps maintain the health of cartilage and joint tissues. When levels drop, inflammation can increase, leading to joint discomfort that affects up to 71% of menopausal women according to recent studies. Symptom number 3, heart palpitations. This one sends women to the emergency room thinking they're having heart attacks. I've had patients describe their hearts racing, fluttering, or skipping beats for no apparent reason. Just 2 weeks ago, Linda rushed to the ER at 2 a.m. because her heart was pounding so hard she could feel it in her throat. After extensive cardiac testing showed her heart was perfectly healthy, she was referred to me. These palpitations were directly related to hormonal fluctuations. During menopause, declining estrogen affects the autonomic nervous system, which controls heart rate. Additionally, fluctuating hormones can trigger adrenaline surges that cause palpitations. While they feel frightening, they're usually harmless in healthy women. Symptom number 4, changes in body odor. This is something women whisper to me about, often feeling embarrassed. They notice their natural scent has changed, sometimes quite dramatically, despite maintaining the same hygiene routine. Maria told me, "Doctor, I've always been very clean, but lately my husband has made comments about a different smell, and I'm mortified. I've tried every deodorant and soap, but nothing seems to help. This happens because hormonal changes affect your body's natural chemistry, including the composition of sweat and oils your skin produces. It's not about cleanliness, it's about biology. Your body's microbiome, particularly in areas like the underarms and groin, changes as hormones shift. Symptom number 5, burning mouth syndrome. This one is particularly frustrating because it's often misdiagnosed. Women experience a burning, scalding sensation in their mouth, tongue, or lips, often described as feeling like they've burned their tongue on hot coffee, but the sensation persists. Janet, a 52-year-old teacher, came to me after seeing 3 different specialists. Her dentist found nothing wrong. An ENT specialist was stumped, and she was beginning to think she was imagining things. The burning was so severe she could barely eat certain foods. This syndrome affects about 18 to 33% of menopausal women. The exact mechanism isn't fully understood, but it's believed to be related to hormonal changes affecting nerve function in the mouth and changes in saliva production. Now, I want to address some common mistakes I see women make when experiencing these symptoms. First, many women dismiss these symptoms as just stress or getting older. While stress can certainly worsen menopausal symptoms, attributing everything to stress means missing the opportunity to address the underlying hormonal causes. Second, I see women jumping from specialist to specialist, getting multiple tests and procedures, because no one is connecting their symptoms to menopause. This leads to unnecessary anxiety, expense, and sometimes inappropriate treatments. Third, many women suffer in silence because they don't realize these symptoms are common and treatable. They think they're the only ones experiencing these bizarre changes, which adds psychological distress to physical discomfort. The most concerning mistake I see is women being told their symptoms are all in their head, or being prescribed antidepressants when the real issue is hormonal. While depression can certainly occur during menopause, not every symptom is psychological. It's crucial to understand that perimenopause, the transition period that can start in your 40s, can cause symptoms to fluctuate wildly. You might have brain fog one week and feel mentally sharp the next. This inconsistency often makes women doubt themselves or makes healthcare providers dismiss their concerns. These first 5 symptoms I've described are just the beginning. What makes them particularly challenging is that they often develop gradually, and women adapt to them without realizing they don't have to live with these changes. In our next chapter, we'll explore 5 more surprising symptoms and, most importantly, discuss what you can do about all of these changes. Because here's what I want every woman to know. These symptoms are real, they're common, and there are effective ways to address them. Let's continue with the remaining 5 symptoms that often go unrecognized, and then I'll give you a comprehensive action plan for addressing all of these changes. Symptom number 6, tingling or crawling sensations, formication. This is one of the strangest symptoms I discuss with patients. Women describe feeling like insects are crawling on their skin, or experiencing tingling, prickling sensations, particularly on their arms, legs, or back. Christina, a 49-year-old nurse, came to me convinced she had a neurological disorder. She said, "Dr. Williams, I keep feeling like there are bugs crawling on my arms, but when I look, there's nothing there. My family thinks I'm losing my mind." This condition, called formication, affects about 15% of menopausal women. It's caused by hormonal changes affecting nerve function and circulation. The fluctuating estrogen levels can cause nerve endings to misfire, creating these phantom sensations. Symptom number 7, changes in taste and smell. Many women notice that foods taste different during menopause, or they develop unusual food aversions or cravings. Some report a metallic taste in their mouth, or find that their favorite foods suddenly taste bland or unpleasant. Patricia told me, "Doctor, coffee tastes terrible now, and I've been drinking the same brand for 20 years. Even chocolate doesn't taste right anymore." These changes occur because estrogen affects our sensory systems, including taste buds and olfactory receptors. Symptom number 8, electric shock sensations. This sounds dramatic, but many women experience sudden, brief electric shock-like sensations, often in their head, arms, or legs. They're usually painless but startling. These brain zaps or electric sensations are thought to be related to fluctuating neurotransmitter levels as hormones change. They're completely harmless, but can be concerning if you don't know what they are. Symptom number 9, digestive changes and bloating hormonal fluctuations significantly affect digestion. Many women notice increased bloating, gas, constipation, or changes in bowel habits during menopause. Karen complained to me, "I look 6 months pregnant by evening every day, no matter what I eat. My jeans don't fit, and I feel uncomfortable constantly." Estrogen affects gut motility and the balance of bacteria in our digestive system. When levels fluctuate, digestive symptoms often follow. Symptom number 10, sleep disruption beyond hot flashes. While everyone knows hot flashes can disrupt sleep, many women experience sleep problems that aren't related to temperature changes. They might fall asleep easily but wake up at 3 a.m. with racing thoughts, or they experience restless legs or frequent waking. Hormonal changes affect multiple systems involved in sleep regulation, including melatonin production and cortisol rhythms. This can create complex sleep disturbances that go far beyond hot flash-related awakenings. Now let's talk about what you can do about these symptoms. When to seek medical help. If you're experiencing several of these symptoms and they're affecting your quality of life, it's time to consult a healthcare provider familiar with menopause management. Don't wait until symptoms become severe. Diagnostic approaches. A good menopause evaluation should include a detailed symptom history, physical examination, and sometimes hormone testing. However, symptoms are often more telling than blood tests, since hormone levels fluctuate dramatically during perimenopause. Treatment options fall into several categories. Hormone therapy can be incredibly effective for many of these symptoms. Both systemic hormone therapy and targeted treatments, like vaginal estrogen, can address multiple symptoms simultaneously. The key is working with a provider who can help you weigh benefits and risks based on your individual health profile. Non-hormonal medications are available for specific symptoms. For example, certain antidepressants can help with hot flashes and mood changes. Gabapentin can address nerve-related symptoms like tingling, and sleep medications might be helpful short-term. Lifestyle modifications can make a significant difference. Regular exercise improves circulation, helps with joint stiffness, and supports better sleep. Stress management through meditation, yoga, or counseling can help with multiple symptoms. Nutritional support is crucial. A diet rich in phytoestrogens, like soy, omega-3 fatty acids, and antioxidants can help support your body during this transition. Some women benefit from supplements like magnesium for sleep and joint health, or vitamin D for bone and immune support. Let me address some dangerous myths. Myth: these symptoms are all in your head. Reality: these are real, physiological changes caused by hormonal fluctuations. Myth: you just have to suffer through menopause. Reality: effective treatments exist, and you don't have to accept uncomfortable symptoms as inevitable. Myth: hormone therapy is dangerous for everyone. Reality: for many women, the benefits of hormone therapy outweigh the risks, especially when started during the menopause transition. Myth: natural remedies are always safer than medical treatments. Reality: natural doesn't always mean safe or effective. Some herbal supplements can interact with medications or have side effects. Your action plan: start keeping a symptom diary. Track which symptoms you experience, when they occur, and their severity. This information is invaluable for your healthcare provider. Find a menopause-knowledgeable healthcare provider. Not all doctors are well-versed in menopause management, so don't hesitate to seek out specialists if needed. Address lifestyle factors. Focus on sleep hygiene, regular exercise, stress management, and nutrition. These foundational elements support your body's ability to cope with hormonal changes. Don't isolate yourself. Connect with other women going through similar experiences. The psychological support is invaluable, and you'll learn you're not alone in these experiences. Remember, menopause is not a disease. It's a natural life transition. However, if symptoms are affecting your quality of life, you deserve support and treatment. You don't have to suffer through this transition, and understanding these lesser-known symptoms is the first step toward feeling like yourself again. As we wrap up today's discussion, I want you to remember the most important message. If you're experiencing any of these 10 uncommon menopause symptoms, you're not imagining things, you're not crazy, and you're definitely not alone. From brain fog and joint aches to tingling sensations and digestive changes, these symptoms are real, they're common, and most importantly, they're manageable with the right approach and support. If this video helped you recognize symptoms you've been experiencing or gave you hope that relief is possible, please hit that subscribe button to stay connected with our VitalHer community. Leave a comment below sharing which symptoms resonate with you. Your experience might help another woman feel less alone. And please, share this video with other women in your life who might be going through similar changes. Thank you for trusting me with this important topic and for prioritizing your health. Remember, knowledge is power, and understanding what's happening in your body is the first step toward feeling confident and comfortable during this natural transition. Until next time, take care of yourselves, and I'll see you in the next video. Dr. Mary Williams, with love from VitalHer.